Hey everyone, in this lecture I'm going to explain the pacemaker action potential in a very simple logical way, and this is going to be an important topic because it will help you to understand how the heart generates its own rhythm and why does the AC node act as a natural pacemaker. The AC nodes are to be considered as the natural pacemakers, and why the AV nodes to be considered as conducting the slow action potentials, right? And how it all actually affects the heart rate to be increase or decrease, and many of the other concepts too, mainly these ones. So the basic idea of the pacemaker cells is that these are the specialized cardiac cells that generate the impulses automatically. So that means they do not need an external nerve to start any of the heartbeat. They are mainly found in AV nodes, SA nodes, right? Among these, SA node is the normal pacemaker of our heart. The SA node is the normal pacemaker of our heart. And the special property of this cell is called automaticity, right? One of these special properties, automaticity, right? It works like that. And this automaticity, what does this mean? This means that this have the ability to depolarize, have the ability to depolarize, and this depolarization is also happens out spontaneously, right? And it generates the rhythmic impulses on their own, right? And this is the most important starting idea. The working myocardial cells in the previous lecture, as we have discussed, for the ventricular myocyte, they need the stimulation to depolarize, but the pacemaker cells, they do not require that, and they usually depolarize on their own until they reach the threshold, and this is why they are called the pacemaker cells. So what is the main difference about the pacemaker action potential? The first thing is that they are quite different from the ventricular action potential, and the key differences lies in that there is no stable resting membrane potential. In these ones, there's no stable resting membrane potential. There are only three important phases, okay, into this one: the phase 0, the phase 3, and the phase 4, right? But over here, the phase 1 and phase 2 is absent, as you can see in the myocardial. In this one, you see that the phase 1, we do have the phase 0, the 2, 3, 4, right? All together different phases, but over here we just have the phase 0, the phase 3, and the phase 4, and the absence of the phase 1 and phase 2. And also another difference between both of them is that the depolarization is mainly due to the calcium influx, but not the sodium influx. As you can see in the ventricular myocytes, it was because of the sodium influx, right? But over here, as you can look up, that is not because of the sodium, but the calcium influx. All right. And another important factor is that the phase 4, it shows the slow spontaneous depolarization, right? The slow spontaneous, we will decode each of that one, but this is the basic framework of the entire topic. All right. So unlike the ventricular muscles where the cell stays stable at the rest until stimulated, the pacemaker cells always slowly moving toward the threshold, and that's why they can generate the impulses automatically. So where does the pacemaker action potential occurs? I've told you in the SA nodes and also in the AV nodes. Okay, this is important because the SA node is the node that determines the heart rate. The SA nodes determines your heart rate. And the AV nodes also does have the pacemaker ability, but its rate is a little bit slower because the SA node depolarizes more quickly, so it usually controls the rhythm of the heart too. So when discussing the pacemaker action potential, the mainly example is usually to be considered as the SA nodal action potential, right? Yeah. And over here you have to understand that the pacemaker cells, they also do not have any sort of the stable resting state, okay? And because they do not have the stable resting membrane potential like the ventricular myocytes, so in the ventricular muscles the phase 4 is stable, but over here, which is the, what was that, minus 85 millivolts or minus 90 millivolts, and let me show you that again over here, that you can look, right, minus 85 millivolt. But the AV nodes and the SA nodes, they do not have that at all, right? It means that this is going to be the central difference between both of them. Now let's try to get into different phases, right? The phases are the phase 0, the rapid upstroke, right? And over here you can just say that we do have why does this phase 0 is functionally important, because the sequences we do have the slow depolarization, right, in the phase 4, slowly and steadily. Slowly and steadily, you see that this actually starts beginning the depolarization, right? And then we do have a quick upstroke into the phase 0 to be seen because of the opening of the calcium channels, right? And later on, what is happening? The repolarization to be seen in the phase 3, the repolarization to be seen in the phase 3. And again, the phase number 4, you see that the quick and the slow spontaneous depolarization starts picking up, right? And the cycle repeats. If I start with a phase 4, which is the slow spontaneous depolarization, this is the most important phase, okay, in the pacemaker cells. Why is that? Because this phase explains why these cells can generate impulses automatically. During the phase 4, the membrane potential slowly becomes less negative until it reaches to a threshold. You see that if this is the threshold, so this phase 4 is reaching slowly to the threshold point, right? And during all that one, this happens because of one of the special inward current known to be as the IF current, or you can say that funny current, right? These funny channels are responsible for the slow mixed sodium and the potassium outward current, okay, the funny current, okay? And this current is usually to be known as unusual, and that is why it is called funny. Because why it is called funny? It behaves differently from many other channels. These channels open during hyperpolarization and allow a very slow net inward positive current. So this current is mainly due to the slow entry of the sodium, while also some contribution related to the potassium outward movement, right? That's why it's to be considered as the funny current. And in addition to that one, we do also have the T types of the calcium channels, right, may also contribute toward the later phase of the 4 and help the cell approach the threshold. So the first one, you can remember our very T types calcium channels, also the inward of the sodium, the outward movement of the potassium, right, because of the funny current, this slow spontaneous depolarization state happens until it reaches to the threshold. And after that, this is also to be considered as the phase 4 is also to be considered as one of the phase which is actually responsible for automaticity, which is also responsible for automaticity, right? And that means the pacemaker property of the SA node and the AV nodes depends mainly on the phase 4. I have previously said that SA nodes are also responsible for the heart rate, right? The heart rates. You see that the slope of the phase 4 in the SA node determines the heart rate. And so why is that? Why the phase 4 determines the heart rate? Because this is the slope of the phase 4 that you are looking up over here. The slope of the phase 4 determines how quickly the pacemaker will reach the threshold, right? And if the phase 4 rises more steeply, the threshold is reached sooner. You see that if we reach up to this threshold quickly, if the steep is going to be very quickly, the threshold is going to be reaching very sooner, right? And if the threshold is reaching sooner, the action potential occurs more frequently. If the action potential occurs more frequently, definitely the heart rate gets what? Increased, right? And if the phase 4 rises more slowly, right? Probably more slow. What is going to happen out? Of course, it is also going to impact the heart rate, and the heart rate gets what? Slower, right? And the few action potentials are actually generating. So can you just understand the cause and effect relationship over here? That the sooner the phase 4 is going to reach up to the threshold, the sooner we are going to have the generation of the action potential, and the heart rate is increasing, and vice versa. Now, let's just try to discuss about the phase 0. So we do have that once we reach up to this threshold, right, the phase 0 actually begins up. And what happens to the phase 0? The phase 0 in the pacemaker cell is different from the phase 0 in the ventricular muscle cells, which we discussed previously. So in ventricular muscle, we have learned that the phase 0 is caused by the rapid opening of the fast sodium channels. But in the pacemaker cell, the resting membrane potential is less negative. Because of this less negative membrane potential, the fast voltated channels remains always and permanently inactivated, right? And definitely results into the slow conduction velocity that is used by the AV node to prolong the transmission from the atria to ventricle. What does that all mean? Now, because the pacemaker cells, they are not going to open up the sodium channels, right? So what is going to happen now? There's no role of the sodium channels to be playing over here. So instead of that one, in the pacemaker action potential phase 0, the opening of the L-type calcium channels happen, okay? And as these calcium channels open, of course, more calcium enters the cell. And when the more calcium enters the cell, the membrane starts getting depolarization. When the membrane starts getting depolarization, you see that going above the 0, the sodium channels, they are automatically the sodium channels are already inactivated. But what about the calcium channels? What is going to happen out to these calcium channels? The calcium channels, they conduct more slower. They conduct more slower. Their conduction is more slower than the sodium ones, right? And that is why the upstroke also starts with getting slower upward, right? So you can just say that the phase, you see, the phase 0 of the pacemaker cell is less steep than of the ventricular cells. Now just see that. Why is that? Because the calcium channels, right, compared to the sodium channels, they do have the slow conductions, right? And over here you see the blue one, and if you just see over here, this is more straight, right? But this one is a little bit curved because of the slow conduction of the calcium channels. So we can just say that the pace, this is in the pacemaker cells, the phase 0, right? We do have the calcium channels to be open. We do have we do have permanently inactivation of the sodium channels, and definitely we can just simply remember it out that this phase 0 happens because of not the sodium influx, but the calcium influx, right? After that, you see the phase 1 or 2 is absent over here, and we can just also try to understand the phase 3, which is the phase of the repolarization once again, right? The repolarization. So after the depolarization, definitely the membrane must have to return to the more negative level, right? That is phase 3. And during this phase, the calcium channels inactivate and that gets closed. The potassium channel gets open, potassium leaves the cell, and as the potassium charges, as the potassium is leaving out the cell, right? There's no influx of the calcium to the membrane, and we can just simply say that the positive charge is leaving the cell, and because of the absence of the positive charge, what is going to happen now? The membrane starts getting negative once again, right? And that is actually due to the potassium efflux. Is due to potassium efflux, and definitely this is not going to actually make out to this repolarization doesn't bring out to a stable point, but actually again the phase 4 slowly and steadily starts reaching out to the threshold, and then another potential, then another, and then another. This happens like that one. Now this is one of the most common questions to be asked, that why does the phase 1 and phase 2 are absent? So these two phases are absent because there is no sharp initial repolarization like the phase 1 in the ventricular myocytes, and there is no plateau formation. There's no plateau formation, right? And because of all that one, the pacemaker cells are actually naturally designed for the rhythmic generation, but they are not actually waiting for any of the stimulus to work. And they're definitely, the behavior is different, all of that one. So, and another question needs to be touched on in this topic is that why conduction is slow in the AV nodes, right? And this also follows from the phase 0, You have to remember that because the upstroke in the nodal tissue is due to slow calcium entry rather than rapid sodium entry. This is due to the slow conduction of the calcium, but not because of the sodium, right? Yeah, so because the sodium channels are permanently inactivated into this one. So whenever we do have the conduction through this tissue slow, right, the AV nodes, right, and the slow AV nodal conduction allows a delay between the atrial contraction and the ventricular contraction. So this delay is physiologically useful because it gives the ventricles the time to fill before they contract. So the slower action potential upstroke in the AV nodal conductions contributes to important AV nodal delay, so that the atriums and the ventricles, they get some time to fill up, right? And that's why they've been written up over here, right? Results in slow conductivity, right? And another important thing, that is usually to be asked, sometimes we can also discuss of that one, the effect of the autonomic nervous system, right? The effect of the autonomic nervous system. So the autonomic nervous system does what? Changes the heart rate, right? Mainly by changing the slope of this phase 4. Okay, what is the effect of the parasympathetic system on this one? Let's just look up to this one. What is going to be the effect of the parasympathetic effect? The parasympathetic stimulation, guys, the parasympathetic stimulation mainly through the vagus nerve, right, and acetylcholines, and also all of these ones, they do decrease the heart rate. Okay, the parasympathetic nervous system through the vagus nerve, acetylcholine, they do decrease the heart rate. So it does this by reducing the slope of the phase 4, right? And if the phase 4 becomes a little bit flatter, right, you see that if it's going very slow, it will reach to the threshold slower, so the heart rate also gets what? Slower, right? And so definitely few action potentials are going to generate up. And definitely we can just simply say that the parasympathetic stimulation causes slower phase 4 depolarization, leading up to the delayed threshold, decreasing firing rate, decreased heart rate. But what about the sympathetic stimulation? What is being done by them? The sympathetic nervous system, actually, the sympathetic stimulation, right, increases, right, increases the heart rate. Why is that? Because the catecholamines increase the slope, of this phase 4. Definitely it is going to become more steeper. The more steeper, definitely more threshold, and the heart rate gets more, right, because of the more generation of the action potential. So one of the most important ways in which the autonomic control regulate the heart rate. I hope so that the concepts are being clear over here. Do try to read up that one and look up to the associated notes, and then test yourself by the given MCQs or the high yield of that the question.